No one has ever told anyone not to ever get pregnant again. No one. For someone that is from a cosmetic surgery, it's a problem.
All right, you know what time it is. Regarding the issue of Elena and her friend trying to get justice for her. First of all, I would like to say may her soul rest in peace. But the truth is, more people are going to die as long as BBL is concerned. Now, let me explain before you start attacking me in the comment section. There was this viral video about an actress, that was given a movie role to play. She went home, she took her time to study her script. On the day of delivery, right, for them to deliver the scene that was given to her, you know what happened there? The producer came in and something happened. She was asked to start acting the village girl, while the other girl will act the city girl. Because why? The girl has a BBL. She was, all curvy and all of that. And she started crying. The video went viral. You see, this is one of the reasons why women will never stop doing BBL. No matter how dangerous it seems, no matter how, the pain is so much. In fact, it is so evidential that the pain of BBL is too much, but people will keep doing it because sometimes they feel less of themselves according to what they say. But the truth still remains that you can still be yourself and make wave. Now, this was a post from her friend, right? Before I play the video of what her friend said, let me quickly read this post, right? They said on February 6, 2026, my sister had liposuctions and fat transfer surgery to her hips, buttocks, and calves at Sinoshore's aesthetic plastic surgery in Ikoyi. 2 days later, she started having severe pain and serious swelling in her hips, calves, and buttocks. We complained immediately. Blood tests showed her white blood cells count was very high, which meant there was infection. Her blood level was also very low, and we had to buy 5 pints of blood for transfusion while she was there. Even with antibiotics, her condition kept getting worse. Her white blood cells count continued to rise. He said her buttocks, hips, and calves became very swollen, tight, red, and inflamed. The doctor assumed that too much fat may have been injected, which might have stopped proper blood flow. On February 13th, they did another surgery, decompression, to remove most of the fat and place drains. She was in terrible pain before and after the surgery. She did not improve. On February 19th, they said they arranged for her transfer to LUTH, but when we got there was no ICU bed, and so arrangement made. No arrangement was made. She was inside the ambulance for 5 hours while she was screaming in severe pain. I was running about to look for bed in LUTH. There was no bed or ICU unit available. The nurse that came with us from Sinoshore's did not bring any pain relief injection. We were left on our own, stranded. She was even confused. They went on to say the nurse made some calls and she said their MD at Sinoshore's asked her to take her to Ednell Hospital in Fastag. After we got there, she immediately left. We paid 1.5 million for 1 day in ICU at Eternal Hospital Fastag. But there was no plastic surgeon to look into her case. This is terrible, right? This is really, really terrible. On February 20th, we quickly moved her again after contacting another doctor. We told her there was a plastic surgeon available at this hospital. At the new hospital, we were given a 6 million naira bill for ICU for a week and surgery for removal of the infected fat, which we had to sell most of our belongings to raise that money so they could, start treatment. Because also the doctor said she had sepsis, a serious infection in the blood, and her condition was 50-50. More tests show her blood level was critically low again, and I had to urgently buy 7 more pints of blood. On February 22nd, she had another major surgery, which doctor removed all the infections from her hips, buttocks, and calves. We almost lost her, but by God's grace, she survived. She is still in the ICU. Doctors are cleaning open wounds every day and treating her for sepsis. She will need another surgery in a few weeks to close the large open wounds. Until then, She has to be on intensive care because her wounds are open. We have used up all our money. We have sold personal belongings. My father is retired and my sister has also been the one taking care of the family. No one from Senegal has called or asked if she's still breathing. They left us to handle this on our own. At this point, everything is too much for me. Now the hospital she's in now is asking for 4.5 million a week and some other extra fees to keep her in ICU and continue her treatment. All right, so this is the basis of which she was calling for justice for her friend. Now, you see, we have to learn, because at every situation in life, there is always a lesson for you to learn. Information reaching us still says that we have a lot of females who are lined up to have surgery done. Some part payment has been made. And even at this scenario, this, this awful information that we are hearing, that this lady went in there and didn't come back, I believe that a lot of girls out there have learned their lesson. This brings us back to the point where, VDM said in his video that people went through this knife, just to increase their pay, because they want people to see them more, right? So you are ready to take this kind of risks just for people to see you, or for you to, I don't know, at what light do you want people to see you that you have to pass through this pain? When I watched the video, and listened to the crying of the girl in questions on TikTok, I was like, damn, this girl was really going through a lot of pains. Well, let's go ahead and learn this lesson, because again, this might come up, but the issue of, getting justice, as long as this girl in question signed a 50-50, agreement, because of course this is 50-50, right? The risk is too much to come over here. For example, you cut some part of your body out, you cut this side just for replacement and filling up and all that. Damn, that's way too much. But the deed has been done, and now she is normal. I just believe that God will give the family, the heart to bear the loss. And also it will be a lesson for every other person out there who is ever thinking of getting a BBL, right? Don't forget to like this video and let me know in the comment section what you think about Elena's that, and what you think people should do moving forward concerning BBL. And I will see you guys on the next one.